Good afternoon, everyone, and a very warm welcome to Pharmacy in Action, Advancing Health Literacy and Equity Worldwide, part of the FIP Advocacy Series. It's really inspiring to see colleagues and partners from every corner of the globe joining us today, united by a common mission to empower patients, strengthen health systems, and promote equity in healthcare. Let's have the next slide, please. My name is Özge Özer, and I will be facilitating today's session. We are very glad to have you with us, and we hope you enjoy the webinar. I would also like to warmly thank my colleague, Albina Labib, FIP's Exhibition and Digital Events Coordinator, who is supporting us behind the scenes today and to ensure everything runs smoothly. Let's get started. Before we begin, I'd like to share a few quick announcements. This webinar is being recorded and also live streamed on YouTube. The full recording will be available afterwards on our website. If you have any questions during the session, please feel free to use the question box provided, and we will address as many as we can. We also welcome your feedback to help us improve, and you can use the link on our screen. And finally, if you are not yet a member of FIP, we would love to have you join our community, and you can have more information about the membership benefits from the link on our screen. And in the next slide, we will have a quick guide on using the live translation feature available on Zoom. So step 1 is to turn on the captions, and step 2, enable the translation toggle, and the step 3 is to choose your preferred language under my caption language. Once you've done this, you'll be able to follow along with live translated captions throughout the webinar. We hope this makes the session even more accessible and enjoyable for everyone. We would like to thank our sponsors, Haleon, for supporting the production of this event. Thank you very much. This 6-part digital series brings together voices from all 6 WHO regions to share practical, innovative, and impactful ways pharmacists are advancing health literacy in their communities. Over the course of these actions, we will explore how our profession is not just responding to health challenges, but proactively transforming the way patients understand and manage their health. Central to today's conversation is FIP's newly launched Insight Report, How Pharmacists Worldwide Are Strengthening Health Literacy and Empowering Patients. This report is more than a collection of data. It tells the story of pharmacists around the world, from community settings to hospitals, who are helping people understand their medicines, navigate complex health information, and make informed decisions to protect their health. It also highlights the systemic barriers that limit our impact, whether that's time pressures, limited resources, or gaps in awareness, and offers actionable strategies to overcome them. In short, it is a blueprint for how pharmacists can truly be catalysts for change. As we dive into today's session, I invite you to think about communities you serve. Consider the ways you can apply these insights to empower patients, strengthen partnerships, and ensure that everyone has access to the knowledge they need to live healthier lives. Please feel free to engage actively, share your questions, experiences, and ideas. This series is a conversation, and every voice do matter. Today, we celebrate the profession's unique role in advancing health literacy and equity. We highlight what is possible when pharmacists lead with knowledge, compassion, and action. So let's begin. Let's learn, share, and be inspired by how pharmacists worldwide are turning knowledge into action, one patient at a time. In the next slide, I will briefly walk you through today's learning objectives. By the end of this session, you will be able to understand the current challenges and innovations in pharmacy remuneration across Europe, and also explore how equitable funding models can improve healthcare access and support greater collaboration. And finally, discuss advocacy strategies that can help advance the recognition of pharmacists' roles. We hope these objectives will guide and enrich today's discussion. Let's have a quick look at today's program. We will begin with a short welcome and introduction, which we already did to outline the theme and goals of the session. And then we will have the main presentations that will provide an overview of the regional status on health literacy based on our recent report. This will be followed by a conversational exchange between our distinguished speakers. And then we will move into a short interactive activity via Slido, followed by a discussion on the results and some key takeaways. To wrap up, we'll have the time for a Q&A session, and we'll close with some final remarks and a call to action. We are very excited for an engaging session, and thank you very much for being with us today. In the next slide, I would also like to touch upon the FIP development goals. They are essential in all FIP programs and linked to the program delivery to the FIP vision and mission via regional and national needs, underpinning all the FIP work to 2030. Development Goal 10, Equity and Equality, which is in line with today's webinar topic, health literacy, is composed of 3 elements. One is workforce and education element, which sets out clear strategies for addressing equity and diversity inequalities in pharmaceutical workforce development, continued education and training, and career progression opportunities. The second practice element indicates all clear strategies for equity and diversity in pharmaceutical services delivery, service access, and service impact, so that all people have access to quality in pharmaceutical care. And the last one, science element, equity in global capacity of pharmaceutical sciences training, research infrastructure, development and manufacturing capabilities, and evidence-based regulatory oversight. And now it is my pleasure to introduce our 2 beautiful, distinguished speakers. Our first speaker is Merete Andresen, Director of Pharmaceutical Affairs. Hanne joined the Pharmacy Association in 2020 and brings nearly 20 years of experience in the pharmaceutical wholesale and retail sectors. From 2014 to 2020, she owned and managed a community pharmacy, a pharmacy she still owns today, where she continues to practice occasionally as a community pharmacist. Her extensive background across both the business and the professional sides of pharmacy makes her a key contributor to advancing pharmaceutical practice and services nationwide. Welcome, Hanne. We are very happy to have you on board today. Our second speaker is Lígia Garcia, who is Senior Health Literacy Specialist at the National Association of Pharmacies. Lígia holds a degree in pharmaceutical sciences from the Faculty of Pharmacy at the University of Lisbon and a postgraduate qualification in public health communication from the Portuguese Catholic University. Over the past 10 years, Lígia has coordinated various initiatives to train pharmacy teams and has developed technical and scientific content on medicines, health, and well-being. Her work supports professional practice while ensuring the public has access to clear and accessible health information. We are truly delighted to have you both of them today with us to share their knowledge and insights. Prior to this event, now we have asked our participants to you a question. Why is advancing remuneration essential to ensuring equitable access to pharmacy services in Europe? And we have the answers available on screen, some highlights from your responses. And now I would like to hand over to Lígia first to ask for your insight. What would you say on this question, and how would you comment on this?
I think I would like to thank you for the invitation. It's a pleasure to be here speaking to all our colleagues on this topic. That it's a passion for me, and I hope to be able to bring insights that are valuable to all of us. I think my opinion and my experience is similar to the comments of our colleagues that I was able to read in this slide. The remuneration is valuable for us pharmacists and for pharmacies because it's clear that it is fundamental. It's a key factor to both pharmacies' sustainability, because it's important for pharmacy services to be remunerated so that pharmacies can actually provide it for the population. And for the population, it is essential so that small pharmacies as well as large pharmacies can be able to provide these services to their communities. Because in a small pharmacy, it's more difficult to have the time and the effort and the team to be able to provide these services if they are not remunerated. And for the team, the pharmacist team, it is important too, because if the pharmacy is sustainable, it's easier for them, for the pharmacists, to have a team, a strong team that can have a strong career development, and an attractive one that can keep the pharmacists in community pharmacy. In Portugal, it has been a challenge in the last years to keep community pharmacists in community pharmacy, because the industry, pharmaceutical industry, has better wages and has more attractive careers. And if we can provide these kinds of services and remunerated services and strong remunerating schemes in the pharmacy, it's easier to attract young people for community pharmacies. So it is important that these kinds of services are remunerated, in fact, for either by insurance companies, but in Portugal we have some of them remunerated already by the national health system, and we are trying to expand those kinds of services. So in my experience, I think it's very important that we enlarge this network of services in the pharmacy.
Very helpful, Lígia. I couldn't agree more. Hanne, what would you say on this?
I totally agree. It's so important that we get remuneration for the services we provide, and that we actually get an acceptance that we are an important part of the healthcare system, and that we are, in many cases, the first place that the inhabitants turn to when they have challenges, and we cannot continue with the pharmacy's business like we do today if we don't get remuneration. So I think it's quite obvious that we have to work on this.
Very true indeed. And Hanne, shall we look at the global overview?
Yes, I will now go through the global overview from the survey, and this shows the survey findings, which reflects then the responses from 149 pharmacists across different regions of the world. Regarding participation of pharmacists in the public health activities, 72% of the pharmacists reported that they had been involved within the past year. The most common areas of involvement were medication safety and adherence, which might be quite obvious, but also infectious diseases and vaccination, which is a growing service in the pharmacies in Europe and worldwide, and then also chronic disease management. If you look at who leads these activities, most campaigns were self-initiated or community-led, followed by those organized through national pharmacy associations or employers or workplaces. This shows that pharmacists are taking initiatives at the community level, often without formal structures driving these efforts. However, when it comes to the use of technology, only 28% of the pharmacists use digital tools regularly, while 45% use them occasionally and 27% not at all. This highlights an opportunity to strengthen digital integration in health promotion and service delivery. And then, looking at the barriers of pharmacist engagement in public health activities on the right side, the main challenges limiting pharmacist engagement are both structural and motivational. The top three are lack of incentives and recognition, lack of time to participate in the campaigns, and limited institutional or employer support. Other barriers include low public interest, insufficient training or health promotion, and limited awareness of available opportunities. Finally, the findings identified 5 key clusters of support and training needs. Tools and resources are needed, skills and knowledge development, recognition and accreditation, collaboration and network, and last but not least, structural and system support. In summary, while pharmacists globally show a strong willingness to contribute to public health, their impact is often constrained by systemic and resource-related barriers. Strengthening institutional support, incentivizing participation, and expanding training opportunities could significantly enhance their public health engagement worldwide. And that's, I think, is important. And by this, I will hand over to my colleague, Lígia.
Thank you, Hanne. This slide, it's very full, but I will explain it in detail. This is a general overview of the survey and interview findings from the European region. The European region was highly represented in this survey. Almost a quarter of the respondents were from the European region. These findings provide a snapshot of pharmacists' engagement in public health, the barriers they face, and the opportunities to strengthen health literacy, illustrated by case examples from participating studies, participating countries, excuse me. Next slide, please. Okay. In total, 34 pharmacists, 23% of the total respondents from 16 countries in the European region participated in the survey. These countries include Albania, Andorra, Croatia, Denmark, Ireland, Italy, Montenegro, the Netherlands, Norway, Poland, Portugal, Romania, Serbia, Spain, Turkey, and the United Kingdom. A significant majority, 77% of respondents, reported participating in public health initiatives within the past year. Among them, 38.23% joined 3 or more initiatives, 20.58% joined 2 to 3 initiatives, and 17.64%, almost 18%, joined 1 initiative. Their involvement was mainly infectious disease and vaccination initiatives, 24%. Hanne already spoke about this. It is an important and a growing service in the European region. followed by activities related to medication safety and adherence, an important role for all pharmacists, 22%, and chronic disease management, 19%, which is an important role for pharmacists also because we are proximity structures to the population, and also the first and the closest in Portugal, at least, it's our experience, the first and the most accessible health center for the patients to come and have support for their illnesses. However, several barriers were identified, the most common being a lack of time to take part in campaigns, 28%. It is an important barrier, followed by limited institutional or employer support, 22%. Other barriers included a lack of incentives or recognition, low public interest, and insufficient training in health promotion. These findings suggest that while pharmacists in Europe are highly engaged in public health, systemic challenges, particularly those relating to time, support, and recognition, limit the sustainability of their involvement. Next slide, please. From the interviewed findings, deeper insights into how pharmacists across Europe are advancing public health through diverse initiatives were gathered. I'm going to give you some country case examples. For instance, in Malta, pharmacists led government-funded medication reviews, monitoring, and chronic disease management, while also taking on new roles in antimicrobial stewardship and home-based care. In Norway, efforts include antibiotic campaigns, patient information leaflets, e-learning, and communication training to tackle medicine misuse and improve adherence. In Germany, highlighted pharmacists' participation in the National Alliance for Health Literacy and Action Plan, offering counseling on blood pressure control, inhaler technique, and transplant patient care. In Romania, pharmacists have led flu vaccination campaigns and awareness programs on cardiovascular and antibiotic stewardship under the message, "Antibiotics are not candy." In Portugal and Spain, showcased strong examples of pharmacy-led immunization services and public health campaigns. In Spain, over 100 national pharmacy-led initiatives focused on medicine use and lifestyle changes, which is also an important role for pharmacists, which are very close to populations. And in Iceland, pharmacists conducted public campaigns on tapering sedatives and reducing the use of sleeping pills through public education and health promotion. These examples highlight the diverse and impactful roles that pharmacists across Europe are playing in public health and patient education. Next slide, please. Also, in this survey, we were able to not only focus on the achievements that were obtained in these countries, but we are also able to identify several challenges that persist in the European region. First, there is the lack of sustainable funding and reimbursement mechanisms, with many pharmacy services such as screening, counseling, and vaccination, which are either self-funded or unpaid, which limit their scalability. Second, restricted access to patient data and inconsistent regulation often constrain pharmacy-led public health programs, making it difficult to track outcomes or integrate care. Third, limited institutional support and recognition remain key barriers, as pharmacists are not always included in national public health programs or formally acknowledged for their contribution. And taken together, these challenges underscore the need for stronger financial, regulatory, and institutional support to fully unlock the potential of pharmacists in delivering public health services. On the other hand, there are clear opportunities to advance equity through pharmacy services. Strengthening patient-pharmacist relationships can enhance trust and improve medication counseling, prevention, and chronic disease management. expanding pharmacist-led education in priority health issues such as vaccine hesitancy, a problem that is growing in Europe. Even in Portugal, we have a very, very strong vaccination program, but even in Portugal, we are feeling this hesitancy in some campaigns, not in children vaccination, but in some campaigns. And non-communicable disease prevention can amplify impact. Embedding health literacy promotion into routine services will help position pharmacists as accessible frontline educators. And finally, supporting pharmacies as community health hubs can transform them into local centers for prevention, screening, and health promotion, helping reduce inequities and improve access. In summary, with proper support and remuneration, pharmacists in Europe are well positioned to deliver equitable, patient-centered health services that strengthen public health system overall. And with that, I think my slides are yes.
So far, yes. Thank you so much to both of you for this regional overview. Very, very helpful. And now it is time for an interactive activity, and we kindly invite our attendees to please join us to participate in the conversation. Let's have the next slide. You may use your device to enter the code at slido.com or scan the QR code on screen. And we're asking you, what should be the priority action to improve health literacy in your region? So while our attendees are reflecting on this and perhaps typing, I would like to ask first Hanne to at least give some time to Lígia to catch her breath. And what would you say on this, Hanne, while our attendees are reflecting and thinking about this? What would be your first comments on this?
Well, I think we are very well positioned to take a much a bigger role in the healthcare system, at least in our country. And I think what should be prioritized is that we start the discussions on how we can contribute with the politicians. And we have to discuss in each and every pharmacy so that all the pharmacists are aware their role and that they take the opportunity. I think you mentioned one patient at a time earlier today, Oscar, and I think that's important because every patient we see in a pharmacy every day, we can really help and to improve their knowledge about their health, how to prevent illness, and it's if we don't do it, it's a really missed opportunity.
Very well put, Hanne. I completely agree. Lígia, any insights from your side?
Yes, my view is the same as Hanne. Every interaction we have with the patient is an opportunity that we cannot miss. We are health professionals above all, and everything that we do in the pharmacy, even if we're not dispensing a medicine, everything we do in a pharmacy is a health education opportunity for a patient. Even if about lifestyle, about physical activity, about everything is an opportunity to intervene in a customer's health. In Portugal, we don't say customer, we say utente, which is it's not a patient because we are health spaces, not disease spaces, and we have many people that go to the pharmacy that are not ill. They are going to do young mothers, children, young people that are going to this pharmacy looking for something to improve their health, not to treat a disease. So we are really, and in Portugal we have several studies that prove that pharmacies have a high level of confidence, and we use those studies to prove to our authorities that we are really an important participant in the healthcare system that has problems, like I imagine most of the modern healthcare systems, and we are good contributors to that. So I think we are evolving in that way in Europe. I think we have several comments in the Slido.
Indeed, we have some engagement, and it is fantastic to see some active participation from attendees. There is a contribution from the Philippines highlighting how community and school-based health education alongside digital tools and local language accessibility can truly strengthen health literacy. It is inspiring to see how participants are already thinking about actionable, locally relevant solutions. And we would love to hear more responses from different regions. This is an event for European regions, but please do continue adding your thoughts on Slido. And we have one more. Absolutely, education is very critical, and we have some curriculum development to straighten the roles of pharmacists. And another prompt, another submission to about education in undergraduate and postgraduate level, so that we can really take the action. Any comments on this, Hanne and Lígia? I see two more attendees are typing. Would you like to comment on these?
I agree that education is really, really important. And I think communication skills is also a key factor for all of us working in pharmacies here.
I can comment on the experience of Philippines. We have in ANF, in my department, we have several materials that we prepare for the pharmacists to go to local schools. We have that kind of relationship. Most pharmacies are invited to speak to young children from 6 to 12, 13, 14, 15, to go and speak to schools at the local level on health care and medication, several subjects, and we have presentations prepared for the pharmacies, and the pharmacist goes to the school and speaks about, for instance, we have presentation about health, but also about digital bullying, about electronic games, about drugs, about sex education, about other subjects, depending on the age of the students. We have to teach, because as Anne was mentioning, most people don't, or some people don't have the ability to decomplicate, to speak in layman terms. We use more complicated terms, so we have those prepared to speak in on the level of the children, so that they are able to understand. So we do that kind of work to prepare to help the pharmacists to reach their level, and to be able to communicate with that public.
Thank you, Lígia. I appreciate your insights, and we have one anonymous comment that just said Africa. Well, what I can say is that we had a similar event to have the overview in the African region, and I believe it took place on 24th of October, and you can see that previous recording on our website. And we also have one more from Egypt, from Eastern Mediterranean region. The next event will be for the Eastern Mediterranean region, but I can say that Omar from Egypt says infrastructure, language barriers, and training and education, communication, networking skills. Yeah, very helpful. So this is all very helpful to support the healthcare professionals and the patients. And with that, maybe we could proceed to the next question. Again, colleagues and participants, you are kindly invited to participate in the conversation. You may use your device to enter this code at the Slido, or simply scan this QR code on your screen. So our next question is, how should pharmacists collaborate with other stakeholders to improve health literacy? Well, it is a good one. Lígia, would you like to start?
For us, and we have that experience in Portugal, we try to work with local structures such as municipalities, parish councils, schools, care or nursing homes for the elderly, universities for the third age, and we have developed programs not only at our level at the Pharmacists Association, but many pharmacies at the local level have a collaboration with these kinds of structures. Promoting health literacy programs, sometimes in small groups. So when it's a pharmacy, it's a small group. It's a pharmacy that goes to a school and has a presentation about these kinds of subjects, and sometimes they ask for our help. Sometimes we have a more structured program that is organized by, for instance, by INF with municipalities, nationwide or at a local level. We try to collaborate also with other healthcare professionals in campaigns. We have a program. When you were making this, FIP was making this study survey. I was able to share with you a program that we had in the Algarve to support the elderly, which involved several institutions, the faculty, the University of Algarve, and local associations of patients, INF, and pharmacies, local pharmacies, to improve the quality of life of the elderly. And it was based on promoting health literacy, and we measured the improvement of the quality of life of those patients. And we worked with nutritionists, with physical educators, with yoga teachers, psychologists, social workers, pharmacists, doctors. And it was truly a networking a network support for those patients. So it's very important to promote those kinds of relationship with other professionals and with other structures, so that we are able to promote health literacy and really and truly help our patients that really need support in their patient journey.
Thank you for this comprehensive overview, Lígia. Very well noted. Hanne, while our attendees are reflecting, and I see 2 participants already typing, would you like to say a few words about this question?
Yes, I can just give you some examples of what we have done. Because every time we see something in the media, in the national media, regarding medications or topics that we can do something about, then we respond to that. And one example is today, the National Institute of Health are concerned because young children in risk groups are not taking their flu vaccine. And then we can respond. We can talk to the National Institute of Health, and we can say that these people, these children, they get the medication from the pharmacies. Their parents pick up the insulin, they pick up the asthma medication in the pharmacies. Why shouldn't we ask everyone if they have got the vaccine this year? And then even though we don't get reimbursed for this service, I think it's a way of just showing them the possibilities that's out there. And we have examples like that because our health authorities are concerned about the use of painkillers among young children. Then we can go in meetings with the health politician and say that we can contribute, we can talk about this when we have these customers in our pharmacies. But then it has to be done in a structured way, and we have to cooperate on making material, information material, and things like that. And then step by step, we are getting more and more accepted, and they look at us as a more, as a healthcare provider. So I think that's just two examples.
And very helpful. Thank you so much, Hanne. I think you have given us a lot to think. And let's look at some responses to this question that we received on Lígia. So I see that some of our participants highlighted the importance of gathering data and evidence to showcase the value of pharmacist-led interventions, especially to secure funding and policy support, while others mentioned health awareness campaigns across different platforms and using evidence-based approaches in patient care. There's also a great point on interprofessional collaboration, including joint community programs and healthcare teams, and even the suggestion of legal frameworks to integrate health literacy into standard practice. So I believe these reflections really show how multifaceted that and strategic collaboration can be advancing health literacy. So thank you all very much. With that said, perhaps we could proceed to the next one, our next question, and the final one, which is asking what strategies can pharmacies implement to make health information more inclusive and accessible. Hanne, any first thoughts that you may want to share with us?
It's difficult to make strategies. I think we have to first accept that all our customers in the pharmacies or all patients are different, and what you communicate to one person might or should maybe be communicated in a total different way to the next one. So I think a strategy would be to have discussions, to learn about communication to different patients, and also to discuss with our patients how would you like to receive the information, because it's a tendency that we know what they need, but it's not always correct.
Lígia, do you have something to say on this?
I was going exactly on the same direction. I had a few notes, and I took a note that said co-creating the content that we prepare for the patients. I was thinking on my experience, because I work in a department that prepares information for patients, and both patients and pharmacists, and in several programs that we design For instance, we are working in minor ailments, and we work in the materials that support the pharmacist activity in those programs. In several, we are focusing in urinary tract infections and in throat infections. And we are trying to gather data to prove to our politicians that we do make a difference in those two infections, that we may help reduce the pressure on the primary care system, and that we can solve some problems in the pharmacy. And those materials that we prepare, when we design them for patients, if we can work in small focus groups, that we can collect the information and the doubts that the patients have, and the way that they need to receive that information. The co-creation process is key to working health literacy, because we think that if we speak like this or that, the information is going to get there. Sometimes we are totally wrong, and the message shouldn't be we shouldn't give a negative message. We should try always to put it in the positive way. We are not punishing them for doing something bad. We are incentivizing them to do something good. So the way that we communicate makes a difference in the way that the patients receive the information. So co-creating and changing the way that we speak to a patient is very, very important. And the accessibility of the information, it's key to work, once again, with several structures. If we can, as pharmacists, work with the structures in our communities, we expand the public that we reach. We are not only reaching the people that come to the pharmacy, and we have a huge network, but we are reaching all the people that are in our community if we extend the scope of our intervention to other locals, schools, the ones that I talked about before. I think it's very, very important that we co-create and collaborate. I think it's very, very important.
It is, and this initiative that we're working on is a testament to that, and the pharmacists will play a key role in this. So having a look at the poll responses that we have received, I see that some participants, we have highlighted the importance of tailored communication, having a nice education, adapting resources to meet diverse needs, and using digital tools like telepharmacy platforms. I see there is a point to ongoing training for pharmacy staff, and gathering patient feedback and regular needs assessment to ensure continuous improvement. Again, it is one of the FIP development goals, CPD, to ensure we have the continuous development for the staff and the pharmacists. There is also a point on multilingual support, about some visualization, and the need to train pharmacists to be culturally responsive, and some key components in making sure that no one is left behind, and we are there for every patient, and one patient at a time, as Hanne kindly suggested. With that said, I think we can proceed with the call to action. Hanne, would you mind?
Yeah, this is an invitation to all of you to participate, and of course advocate for fair remuneration with your local pharmacy association or your regulators, and to gather data to show the value of the services you provide, participate and discuss on sustainable funding models, support pilots demonstrating equitable service delivery, and share examples, because I think we all need to learn from each other so that we stay together and work to make people aware of all the good services they can get from the pharmacists in the pharmacies. So I will again invite you to join the campaigns and to support the work that's being done by FIP.
And a big thank you from our side to you, Hanne and Lígia, for your continued support and leadership in making this happen. In the next slides, we will ask for some comments so that we can build on the work and that big work that we have started here. So we would appreciate your comments even now or after the event so that we could improve our offerings. With that said, we can also proceed to the Q&A time. So once again, thank you both for your valuable insights today. We have some questions in the Q&A box, but while I'm looking at that, perhaps one thing that the first thing that comes to my mind is asking you both, how do you see this call to action being applied in your own country or setting? Are there any specific plans, initiatives, or next steps you're considering to support its implementation, in addition to what you have been kindly sharing throughout this event? Hanne, perhaps we can start with you. Please do.
Yeah, well, in Norway, we will continue with all the things that's described in the report. We will have a national campaign next year where we focus on nasal spray, and this will be supported by all the pharmacies in Norway. And we will continue to have campaigns in cooperation with national authorities. But of course, there's a long way to be accepted as an important part of the healthcare system. So we have to work hard every day to achieve remuneration and to get the acceptance for new services in the pharmacies.
Very good to hear that we will have a starting point. Lígia, any reflections from your side?
As Hanne was saying, we will continue to do what we already have put in place. We already have some remuneration, for instance, in the flu and COVID campaign, a seasonal campaign. We have vaccination in the pharmacy from people from, I don't know if I'm going to say something wrong, but I don't think so. From 60 to 84 years old can be vaccinated in the pharmacy. It's a group risk, it's specific group of interval of age of people can be vaccinated in the pharmacy for free, as if they were vaccinated in a primary care center. Okay. It's a seasonal campaign in the pharmacy. We had that in the previous campaigns. COVID only last year, in this year, and I think COVID was last year and this year, and we will continue on that. Those people can also be vaccinated in primary care, and in primary care, the younger people belonging to group risks and the from 85 above are only vaccinated in primary care, and the pharmacy is remunerated for that service. We also have the dispensing of hospital medicine in some in a defined framework for some patients in the pharmacy with remuneration. It began in a short period. It's starting in the pharmacy, and we are starting collecting data. Data is very important in those two minor ailment ITU, urinary tract infection and throat infection, that we are trying to be the first responders in identifying what can be treated in the pharmacy, viral infection, and what should be treated by a doctor when it's needed, and antibiotic. And we are trying to collect data because the pharmacists register in the software of the pharmacy to prove that pharmacists can really intervene in those, we take off pressure in the healthcare system, so that we are working to be remunerated by that services, those services in the pharmacy. But we are still trying, and we design. It's an important part of promoting health literacy in the correct use of antibiotics in those two situations, because people tend to think that we should take an antibiotic if our throat is sore or we have urinary symptoms, and it's not always the case. And we have also a national promotion health literacy promotion plan designed by our healthcare directorate, which includes several steps. It was designed from 2023 to 2030, and pharmacists are included in that design. But so we should try to design our actions following that plan to be easier to be included in those politics designed by our health ministry. I think it's that.
Very, very helpful. Thank you so much to both of you. We have some more questions in the Q&A box, but as we are running a bit short on time, we may not be able to address every question live today. However, we will review them after today's webinar and explore how we can respond or integrate them into our follow-up communications or future events. So thank you again for your active participation. And now I would like to have some closing remarks. Thank you once again very, very much to our speakers for their valuable insights, to our FIP team for their dedication in making this series possible, and to all of you in the audience for your active engagement and contributions. We look forward to carrying the inspiration and learning we've shared today to continue to champion health literacy, equity, and patient empowerment in every interaction. We believe that together we can all strengthen the health of communities worldwide. We hope you can join us for the next event on 11th of September, focusing on the Eastern Mediterranean region, and you can find the link on our website, and I'll also make sure to share it in the chat as well. A kind reminder before we close, again in the next slide, about our call to action as we wrap up today's session. We would like to take this conversation beyond the screen, and we invite you to use what you have heard to inspire action in your pharmacy, community, or classroom. Please do share these ideas with your networks, start local initiatives, and advocate for policies that strengthen health literacy and equity, and also know that we are here to support you. We can turn today's insights into lasting change, we believe, and we would like to ensure that no one is left behind on the path to better health for all. You can check all of our upcoming digital events, including the one on the 11th for the Eastern Mediterranean region from the link on screen. And one last information before we close. I would like to warmly invite you to the 84th FIP World Congress, which will take place in Montreal, Canada, from 30th August to 2nd of September next year. We have the Congress theme, One Health, One Pharmacy, bridging science, practice, and education. This global Congress will bring together pharmacists, scientists, and educations to explore how our profession can drive better health outcomes, ensure equitable access to medicines, and straighten health systems globally. We hope to see you there. It is for some, I believe it will be a bit hard to be there in Canada. It's a bit far, but we hope to see many of you there. And in the next slide, you'll see some important dates. All information are available in our website, and we would be happy to assist you if you send us a quick email. Thank you very much for attending, and we look forward to seeing you soon. Thank you all.